But speaking to patients, reading comments from my YouTube channel, I'm definitely hearing more and more about something called a dumping syndrome. Very elegant term, but the word dumping does make sense. You'll hear in a moment. But this is one of the side effects of having hiatal hernia surgery, and it is most common with the procedure called a Nissen, just named after the doctor, fundoplication. So the fundus is the upper part of your stomach, and plication just means a folding, and or wrapping, and that's what they do. They take the upper part of the stomach and they wrap it around the esophagus to make it less likely that reflux will happen. So that's what they're targeting. So with this dumping syndrome, what it's referring to is that your stomach, food goes into your stomach and then it rapidly empties into your small intestine, and creating some really undesirable symptoms, very undesirable symptoms. Because what should happen is when food enters your stomach, it's kind of churned around in your stomach, and the contents should be there half an hour plus, and a lot of absorption takes place. And that's one of the things I comment about with PPI medications, is that because they diminish the acid in the stomach, you're diminishing your ability to absorb. So if things are moving too rapidly through the stomach, again, you're diminishing your ability to break down your food and also absorb certain minerals and vitamins. So that's a problem. How frequently does it happen, the dumping syndrome? Up to 20% of the time. So this is not a 2% incidence. This is an up to 20% incidence, which is really high. That's something, obviously 1 in 5. So something to really consider before you jump into these surgeries. And I do feel that they are recommended way too frequently for those who have small sliding hiatal hernias up to medium size sliding hiatal hernias. I say sliding because 95% of them are sliding. So there's so much that can be done to rebalance, tone, regain optimal function without necessarily putting yourself in potential harm's way with the surgery. Again, I don't think they're never indicated, but I think they're recommended way too often, and I don't think patients are given the full perspective of what can happen. So why does it happen? The one thing is what they're doing in the surgery is they're tightening the lower esophageal sphincter. So the sphincter is just a valve, and the lower esophageal sphincter is just above where your stomach is, and when a hiatal hernia happens and part of the stomach comes up into the esophagus, then that sphincter can be damaged to a degree, and so they're tightening it up. So that's one reason why it happens. The other thing is that when the stomach is repositioned or wrapped, which really is the definition of the surgery, so they're saying that the why is the surgery itself. The other why was that sometimes with the surgery, they're shortening the esophagus, so that can cause problems.